All right, welcome neighbors. I'm Melissa Petrini. Just want to thank you all for coming here. If you're interested in your own community. These meetings started about almost a year ago, mostly from just interest that neighbors needed to start talking to each other, meeting one another, and collaborating and creating solutions instead of pointing fingers. So before we get started on the meeting, I always read some rules of etiquette for being here, and this is what I think helps the meeting be meaningful for a lot of people. So the first one is that we will maintain orderly conduct, be considerate of other viewpoints, experiences, and concerns, and be respectful to all individuals in attendance. Please raise hands if you have questions or comments. Please no interrupting. There's no political finger pointing, shouting, or name calling in this meeting. We are looking for ideas and solutions. And please ask genuine questions that will lead a discussion and not divide it. If you cannot abide by these rules, you will be asked to leave. And we'll have our Scott, he's going to be our bouncer for the night. And I can't do it. So first of all, again, thank you for all coming. And we want to welcome, and we have our RRT Rapid Relief Team that has provided the food for tonight. So please feel free at any point to go get some more if you'd like. I think they have plenty of meals. I'm going to have them come in a minute and just tell you about their organization and what they do, and maybe ways that you can help their organization continue to help other people. And so before we get started, I have kind of some housekeeping. The first thing is that on the back of your agenda is some local volunteer opportunities that we kind of put together. Some different things, like I just learned about a film that's going to be shown talking about Medicare for All. So if you're interested in learning more about that, so there's a film showing that. Seattle King County Clinic is having a dental and medical free clinic for 4 days. They're looking for volunteers, so there's information if you're interested in signing up and volunteering and helping. Highline Medical Emergency Room has a clothing closet. They're always in need of clothing for people who come in, especially those who are on the street sometimes just don't have the proper clothing or shoes or coats, and so their goal is to discharge with dignity, to make sure that everyone walks out of there with what they need. So there's some information on different items you can always drop off to them. They also have an Amazon wish list. And a lot of other really great organizations. I think in doing this, what we've found is there's just so much out there, and we need to find a way to connect people with those services that exist, and also try to figure out where's the disconnect. When there is so much services that's available, why is this not helping the people on the streets? And I think we're continuing to dig and figure out what bridges do we need to build and where are the holes. So we invite different speakers to come and educate us about what is happening out there so that we can be better prepared of how to handle what we see out there, have a little more compassion, but also how do we help strengthen our community and be safer, which is ultimately, I think, our ultimate goal. We have Susan West, who's Normandy Park City Council, and she's also with Friends of Normandy Park, which is a nonprofit organization. We have a little fundraiser that's coming up. They just want to tell you about it real quick and looking for volunteers. So go ahead.
Well, thank you so much. Thank you for the opportunity to just say a couple words about our foundation. So as Melissa said, I'm on the council, and while on the council, I found that there was an incredible need for fundraising to help people, and many different people with different organizations and different issues and challenges. And so that's how the Friends of Normandy Park Foundation started back in 2013. It's a 501c3, and we're open-minded about who we're going to help and how we're going to help them. It's not an organization that just helps one entity, one group. We would love to get your ideas of what we can do to help the community and how we can fundraise and make sure that we are reaching out to as many people as we can. So an example of what we've done, we've raised money for the Highland Schools Foundation, so for our students. We put on the annual tree lighting ceremony at Normandy Park Town Center, and we invite, I think it's 24 schools to be there. And we advertise all over King County, Snohomish County, Pierce County. We want everyone to be there. There's no admission to that event. We've given away thousands of toys over the years. We also put on a disaster preparedness festival. The theme is a little crazy, it's zombies, it's Zombie Fest, but believe it or not, that really pulls people in. But we teach people about disaster preparedness. We have National Guard there, and all sorts of different government agencies. And we make a point of, with our events, with those festivals, of never charging admission. Because we want anyone to be able to go to them and not think about, am I going to be able to feed my kids tonight, or do I take them to this festival? We want everyone to enjoy their time. So for example, with Winterfest, the event we just had, we gave away, I think it was 500 Santa hats to kids and antlers, 700 toys, candy canes. We just want everyone to be happy and feel like they can just be together and have some joy. So I want to tell you about an opportunity to help that continue. So you'll see on your seat, there's a Mardi Gras event coming up. So it's a first ever fundraising event. It's a dinner auction and a dance party, and we thought, why not Mardi Gras? Because that can get people really energized. And all of that money is going to go toward the events I just told you about, but new ones that we can add. And it would be great to hear from all of you in the future, and I'm going to pass this around. If you'd like to sign up to be a volunteer, or if you'd like to sign up to come to the event, or if you just have ideas of how Friends of Normandy Park Foundation can help the people that you're going to be talking about tonight, or other entities, other groups. We've helped with pet food drives. We've helped with offering babysitting classes to teach teenagers how to do that. We're open-minded about who we can help. So we're just here to do what we can, and we look forward to your ideas. So I hope you'll join us for this event. It should be a lot of fun. We have exciting auction items that we're going to be auctioning off, like Alaska Airlines round-trip tickets, Mariners tickets, all sorts of exciting things. And again, all that money is going to go toward not just helping Normandy Park, but we help Des Moines, we help Burien. We want to reach out to the region and make sure that we're helping as many people as we can. So anyway, thank you for the opportunity. And I'm Susan West, if you want to reach me, and I'm just passing around that sign-in sheet. So thank you.
Thank you. One of the so our group, we kind of a smaller think tank group that we get together every month, and we've been trying to just, as we have been going through these meetings, discovering what the needs are and, getting feedback from people. One of the people that we were able to meet, Dean Orico and Martin Burien. Did I say it, Brett?
Neither one.
What's that? Say it again?
Either one.
Either one?
Orico and Barrett.
Okay, there we go. And they've been doing almost the same thing, but on a different scale, is with local business owners. And they've been meeting over the last few years in discovering, issues that they've had with hiring talent, people who don't want to come to Burien or just, Seattle. Why is that? And so I wanted them to come up and talk about what they've been doing and how we now as a group are going to be starting to get together quarterly and creating a new kind of entity called Highline Good Neighbors. And that's residents and business owners coming together and creating solutions for our community. And we think that we would have a lot more, hopefully, clout when we go and present, hopefully to cities and businesses, and trying to discover, how do we make our city safe and secure, and how do we help the people on the street using compassion. And compassion looks so many different ways, and that's what we're discovering. So I'm going to invite Dean to come up and just quickly talk for a minute or two about what they've been doing and how we're going to be hopefully progressing in that direction.
They really are a think tank. It was an extraordinary short lunch meeting that we had, and it was exciting to hear what's going on here. I really feel I shouldn't be using up any time at this meeting because there are some extraordinarily intelligent and influential people here that should be up here instead. But I'll just quickly say, it was actually only about 1.5 years ago, Martin was trying to hire for his amazing company some good talent from around the Puget Sound area, and they loved his vision. They were thankful for the salary and benefits, but as soon as they found out it was Burien, the conversation cooled. So in that subsequent conversation, we said, what can be done to change the image of Burien in the eyes of the Puget Sound? And so I went back and I started doing a study of the 50 best small towns in the United States and what they had in common. So what kinds of things we already have that we can emphasize, what could we add? what could happen to Burien to make it an attractive place, especially for the millennial generation, because we found that they don't go buy a house and then find things to do. They look for things to do and then go buy a house near it. So as we decided, well, what came out of the survey was that in every case, those small towns had an identity. When you heard their name, you thought of something. Whether it was their local fruits, their production, a Civil War general, something. There was always something that drew people to that city. There were also a lot of other things in common, like great restaurants and arts and entertainment and museums and other things that were very much in common, but that was the one that stood out. We found the most obvious local example of that was Leavenworth. Leavenworth in the 60s, if you don't know, it had nothing to do with Bavarian town. It looked, even their own website said it was closer to Deadwood than a Bavarian town. But some business owners and some leaders in the town got together and said, many people comment that it's like a Bavarian foothills here, or Bavarian, why don't we turn it into a Bavarian town? And through that leadership, obviously, it took a lot of leadership to get all the storefronts looking the same and a lot of changes made. But through that, now they have millions of visitors instead of a floundering, nearly dead Western hill town. So instead of making up an identity, we started surveying business leaders. So I happened to have some spare time on my hands at that time. So I walked up and down 152nd and I surveyed about 80 business leaders and said, if an identity could actually do something to create leadership and excitement in this town, what do you think the identity of Burien is? You've lived here, you've raised your family here, you're running a business, and I was surprised. I thought it might be proximity to the Sound or to the airport or straight shot to downtown Seattle. But the one thing that was overwhelmingly the #1 issue was that people felt like there was a small town sense of goodwill. There were multi-generational families, some with great influence in the community, and it was just a goodwill, fellowship, generosity. When you walk into a restaurant in Burien, many of you know, a lot of the towns nearby here, you don't get what they call the Seattle freeze, where you just go in and sit at your table and talk to whoever you're talking to. But you are yelled at by somebody across the room, and often the proprietor of the place, and there's just that sense of warmth. One kind of astute businessman said, you don't see people wearing "I heart Renta now" on t-shirts, and yet you get a lot of that kind of sentiment in the Burien area. So we said, what could we actually ended up gathering something over 40 business owners for a dinner, and we said, based on this survey, this is kind of the identity that people are coming up with. What could we do without garnering any city funds, just as business people? How could we all market together this idea and come together and start to change the image of Burien? And so the first step was we started the Burien First Friday events. I don't know if you've experienced any of those, but out of that bigger group, a small council got together and came up with this idea. So the first Friday of every month, we stay open, the businesses from 6 to 9, bring in musicians, artists, poetry readers, anything to entertain. We encourage the business owners to promote each other, either cooperate in some kind of activity, or when customers come in, tell them about what's going to be happening across the street. And so we also wanted to continue to engender that sense of community and generosity and loyalty to each other, that kind of thing. So the next step, and I'll be quick on this, but although it's been great in bringing the business people together, and I think it's caused a little hum, it certainly hasn't changed the view of Burien to the people who live in Kirkland and Ballard. By the way, Kirkland and Ballard, we feel, are Burien's competitors. That's where we should be, for goodness sakes. We're this close to the airport, we're on Puget Sound. As another astute business leader chimed in, and he said, where do you find a crappy seaside town? So anyway, we think there's a lot of upside in Burien. And so, but we feel like the next step is there has already been a rumbling in many quarters about the idea of Burien becoming a creative district. There's actually a state-sanctioned term now called creative district, where you can get benefits and incentives for business owners who might want to come in and do some developing. We have, as you know, all down in here, we have an extraordinary percentage of artistic people who, some very qualified and kind of hidden in our neighborhood. And so we're working now, the chamber has already started some work, but the first thing the state said was, and this is what I'm most thankful for, and this is where I'll end, they said, the first step is you have to have a broad-based constituency. You have to have business people, the city, the chamber, the residents, artists, everybody coming together to work on this project. So to me, that means there aren't going to be any hidden agendas, there aren't going to be any kingdom building, but we're actually going to all work together for the benefit of Burien. So that's our next step, and we'll be having some meetings coming up the next quarter in that direction. Yeah, and I'm thrilled to be involved.
I think creating the community that we want to see, and of course, I think that includes safety and how do we can't have this beautiful shining city if we've got homeless people on our streets that are suffering and need help, and we need to help figure out how we can do that. And so our next speakers are going to be talking about that so we can better understand, I think, the mental health crisis that's happening out there and the drug abuse crisis that we're experiencing. And so just real quickly before we get to our main speakers, thank you for your patience. I want to give RRT just a minute because they're the ones that provide the meals tonight. And I want them to tell you what they do and if there's any opportunities for people to help. So I have Earl and Fred Gracie here that are going to talk for just a minute.
Yeah, thank you.
Thank you.
Thanks, Melissa. Well, I guess you're probably wondering who all these guys and ladies are in uniforms and red aprons. And first of all, most of us are actually residents of the park and are Burien, but we're connected with Rapid Relief Team, which is based out of Sydney, Australia, actually. And it's a global organization, and it runs through North America and the Americas and the Caribbean. North America, last year we served about 25,000 meals and several different types of proactive and reactive type events. So normally we're on scenes of disaster, and we're assisting charities that are doing something for youth, homelessness, low-income families. We delivered 5,000 meals on Christmas Eve to families that couldn't have otherwise had the privilege. So Melissa reached out to us and we saw what she was doing, and this was just a way that we could help support this wonderful conversation that's starting to take place, and residents actually taking ownership of a situation and starting to seeking first, to understand and get educated about the problem. And then there's so many ideas from good people trying to help people who are down on their luck or have fallen off the tracks a bit and in need a helping hand. So we're just here to not to take any focus away from what Melissa and all of you are trying to do here. We're just trying to support from behind the scenes and be good neighbors. And as far as supporting RT goes, we do have a bit of a rigorous training process to actually run the equipment and serve the food. And we're certainly not saying, no, you can't join. It's just a process we go through. Or you can donate. The whole program is run strictly off donations, so there's a tab on the website if you're ever so inclined. But again, we're here to try and help this. It's very important what's happening, and it's distressing to see the homelessness situation all through the city. And yeah, look forward to the conversation continuing. Thank you.
Thank you.
There are a couple seats that just scattered throughout if you're wanting to have a seat. Then without further ado, we're going to welcome Tina, and also just let you know that we have B-Town blog here that's going to be recording it, and there'll be a link later, and I think we have Como News here. So we're just excited for all the
Good evening. I'm Tina Orwell, and thank you for the honor of representing us in Olympia. I smile every time I come to City Hall. My daughter went to Miss Melanie's class, and my son was in the pre-K, and anything Teacher Diane told him was the law in our home. He could not disobey Teacher Diane. But one of the things I remember, with my kids growing up in Normie Park, and my son said it one day, he said, this is a place where grandmas can walk and feel safe. And I thought, that's so telling, right? This is our community. And there were days where he probably didn't like it, where I'd get a call, Alec isn't wearing his helmet and he's on his bike, right? And, yeah, we all disappoint each other's kids at the pool, but it is a special place. And it really warms my heart to see you here tonight because it's, you know, it's a community that you make your voice heard and you want to know what you can do to make a difference. So thank you, and it's good to see so many of your local leaders here as well. So a little bit just about my background. I'm a mental health professional. I worked 20 years in community mental health. I worked on the involuntary psychiatric unit. I worked at the Western State Hospital. I did that for about 20 years. And so it's something that's near and dear to my heart. And a lot has changed around behavioral health, and we'll talk about that tonight. One of the things I wanted to share is I used to work downtown Seattle. It was called Highline ENT Evaluation Treatment Facility. And it was co-located with detox and involuntary treatment, and we all kind of knew each other. And there was this incredible man named Dutch. And Dutch worked there, and he drove around a detox van. And the detox van would go all around downtown and would pick up people that were basically sleeping. You've seen people obviously sleeping on the road, on the sidewalks, and he would take them back to the sobering station. And he was our greeter. You know, every morning going in, he was smiling there to greet us and kind of pump us up for our job. And you could tell when he helped the people off the detox van that they were precious to him, right? And it was really a calling from his heart. And I remember sitting one day talking to him, and I said, what made you decide to do this? You know, obviously you care so much. And he said, I was homeless for 10 years. I was one of the people used to step over. And it has always struck me that everybody has a story, and everybody has something to give back to the community. And what can we be doing to support people so that they can reach their potential and be part of our community? And so anyway, he certainly influenced my life. Very much so. One of the things I was doing actually right before I joined the legislature is I was a state director of a program called Housing First. And you've had a lot of speakers, so all these terms you may know or you may not know. But Housing First, I think we created, working with nonprofits, about 1,000 units of housing for chronically homeless individuals. These are people that have usually been on the streets a year, 2 years. And we started working on this, and I learned a lot. One of the things I learned is about 25% of people that are long-term homeless were veterans. Well, my dad was a veteran, and that was really near and dear to my heart. I remember they opened one project at Plymouth for veterans that were homeless, and they placed somebody who had served in the Korean War. It's like he'd been on the street for 10 years, and it just breaks your heart. So we learned about this model, and it's been highly effective. Again, it's about wrapping services and supports when people come off the street. One of the most famous ones is actually the 1811. And I was downtown Seattle. It's downtown by the REI. I don't know if people have been to the REI. And I was there because I was at this little restaurant that's right next door to the 1811. And I went in there. The owner was actually at the counter. And I said, well, what's it like being next to the 1811, which is a Housing First project? Because it was a little hard in the beginning. A lot of the men would come over, but eventually they just come to buy something to drink or something to eat, and they're in the dining area. But the 1811 was run by the Downtown Emergency Service Center, it still is. They went out and they went to people that had been on the streets for years with drug and alcohol, but mostly heavy alcohol. And they said, would you like a place to live? We can give you a key tomorrow. And I think they approached about 55 people, and 47 were housed of the 52 people. You know, so you always have in your mind, it's like, do people want to be homeless, or have we not figured out the right thing to offer them at the right time? And that model, actually what it showed is we can house people with services for about $40,000 to $50,000 a year. When they went back and looked at people's use of services prior to that, some of them had spent over $1 million going in and out of emergency rooms. You know, we paid for that one way or another, right? And yet that wasn't the care they needed. One of the things that I did when I worked over this Housing First is we would have people all over the country that would come watch it or want to visit. I remember having a delegation from Texas and the mayor of Fort Worth being there, and he was so excited. He sent me a card later and a cookbook. That was really interesting to send. It had great brownies in it, but that's interesting. And then we had Utah, and this great guy named Lloyd came. And years later, I read about Lloyd. Utah, using the model we have, decreased their chronic homelessness by 91%. They went from 2,000 chronically homeless to 200. And I thought, okay, they came, got our model. Why did it work so much better in Utah than it worked here? You know, it kind of made me wonder. And I started thinking about it. One, we're probably a bigger state with a bigger population. They came at it with a state perspective. They also had public-private partnerships, and their business community was very involved. But one of the things I've seen is often, and I think we struggle in South King County, is we have all these housing providers. They get the Seattle levy, which is extra dollars. We don't have those dollars in South King, right? We don't have the ways of getting the more affordable units in our communities like Seattle does. We also have trouble siting some of these projects, and part of it is we don't want a 100-unit building like they put in Seattle. That doesn't fit in our community, right? These 100, 150-unit buildings. We need smaller places. We need smaller places that integrate into our community. So we haven't figured out kind of the combination to get more affordable housing. We also have an option of workforce housing. We have a whole new funding source, and a lot of dollars are going to Seattle and Bellevue. And again, I think we need to be partnering as a community, saying we need these resources here in South King. And I know you had Dave Upthebro from King County Council. He's one of our partners, along with Dow. But I do think we've got to figure out how to do it, how to site it, and what it should look like. I talked to, did the PATH program from Sound come to visit you? Sound is one of our behavioral health agencies. And they have the outreach workers, and maybe you've seen them. They come mostly to Burien. I don't know that they spend a lot of time in Normandy Park, and they actually engage people who are homeless. And when I talked to them, they said they used to have housing first units in Burien, but a private landlord came in, bought a building, and they won't take them anymore. So they lost all the vouchers they were using to house people that were homeless. And so we do have to kind of rethink these models and resources of how should they look in our community? Like, how do we work with the housing authorities to bring those back? The other thing that's going on with behavioral health, and I know you'll hear it, my colleague and friend, Sherry, is that we have a lot of changes going on with behavioral health. One of the things I work a lot on is suicide prevention. Sadly, we have one of the highest rates of teen suicide in the country. And so we've been trying to gear resources for our children, but we have trouble accessing actual mental health services. We also, I think we're like ranked 46 for access, and we have a lot of need. And part of it is, one, we have a crisis in the workforce. We have agencies that have hundreds of openings where they can't get anyone hired. And again, yes, we need to increase those rates. We need to make sure there's good training. But there's another thing going on in our area. My future son-in-law, he just got a BS from University of Washington in psychology. Normally they would come enter like the behavioral health field. He got hired by Facebook. I mean, not only are we competing, for where people go for pay, we're competing with all kind of incredible industries that we have in our area. So I do think the legislature, we're trying to look at, can we create loan forgiveness programs? People that are coming with debt, right? Can we help young people that want to work in our field not be just drowning in student debt? Can we provide the right training skills? When you see outreach workers working with people that are homeless, there's often motivational interviewing, which is really trying to make a connection and help people relook at their lives in a way to help bring them in, right? To help say, what do you hope your life would look like? Also, there's a lot of trauma on the streets, and a lot of the skill set is how do you work with people with trauma who might have difficulty forming a relationship with someone. Because they've been hurt and harmed. And so part of our plan is again, increasing rates to the providers, doing more training for behavioral health specialists and with the skill sets they need, and looking at loan forgiveness. Now, one of the things we did last year is actually around college tuition, where a lot of families that have kind of a low, moderate, I think it's $60,000 or less, will get their kids will go to higher ed at no cost. So basically, most kids from many homes will go at no cost, and people from higher homes will go at a reduced rate that are in state. So we are trying to make it more affordable. I do hope that helps some of our crises that we have in the health and human services. You know, again, you know, I'm always struck by the stories I hear when I talk to the outreach workers. They do come to Burien, they come to the library there, and they also come to the drop-in centers. And the increases we've seen lately have been with women. It used to be, and they said that they feel like there's a gap right now for services for homeless women who don't have children or not part of domestic violence situations. And that's where their biggest increase has been. So I think as a community, I think that's good information to know, like what should we be doing for women. They've also seen increased homelessness, homeless women veterans. And again, you know, have we created the specialized services for people that have served our country, men and women? The other thing I do a lot of work on is trafficking. Unfortunately, we have one of the highest rates of trafficking in the country. And these young adults, the average age is 15, but we have as young as 11. And SeaTac area and the surrounding area is a lot of activity around this occurring. And often if there are runaways or homeless, the youth, they are quickly targeted by pimps and exploiters. And we're trying to figure out what are the best approaches to working with them. Law enforcement is amazing in our area. I work with all our police chiefs. They're doing stings, they're doing great work trying to go after those that are exploiting. What we're trying to do with NAVOs, are people familiar with NAVOs in Burien? Is they have some empty kind of pod facilities on Lake Burien, and we're going to try to open up receiving centers. These will be places that law enforcement and other professionals can take homeless youth or youth that are being trafficked to have them somewhere safe, to help engage them and get them off the streets and into care. This will be the first in our state. We're looking to open one in Spokane. I'm really proud. I think this is a new approach. I often work with survivors who said, I was on the streets at 13, and I kept thinking, I don't know how to get out. I don't know how to get help. And we're really hoping this model will break that cycle for these youth. So another population that has gone up is the youth, especially also transgender youth. So those are some of the increases we saw over the last year. So again, I think we're trying to kind of tailor our services to really be more effective for those at risk. Families, I think one of the best approaches is getting more workforce housing. Again, I met Mayor Ralph from Kent, and I met with Dow Constantine trying to say, how do we get more of this workforce housing? Because a lot of families are working. They still can't afford the rent, right? So they need that next step. And so we are working with Dave Up the Grove and others. I think there's about $70 million set aside if we could try to develop that in our community. And again, I think that would help a lot of families that are living on the edge or are homeless. So, you know, when I work on issues, whether it's suicide prevention, I work a lot on the rape kit situation and getting those tested, trafficking, there's not one solution. There's not one solution to homelessness, but I do think that working together at all the different levels and with the community, we can come up with a set of solutions. I think we could be just as good or as effective as Utah, if not better, right? And we do need to ask ourselves why, what have we not done to implement these models when we know what the best practices are? You know, how do we take them to scale, and how do we work with the community? And what should it look like in our area? We're not Seattle. I spend half my day saying we're not Seattle. That's like my mantra, right? We do things differently, and we do things with, I think, a softer community touch. And so I really hope we can figure out what models we need to be building. And again, I think there's certain areas that have done more of this work as far as affordable housing, but we do need to bring in the experts that know how to develop it, but we want to be part of what it should look like in the services. So that's a little backdrop. I don't know, Sherry, if you want to jump in and talk more about the chemical dependency, and then we'll open up for questions. There's a lot going on there. So,
You have a,
Yeah, no, let's go ahead. I think it's good to hear from kind of both sides, and then when we open it up for questions, you know, raise your hand, let us know if you have a comment, and if you have a comment, keep it under a minute. If you have a question, you know, then hopefully answer the discussion.
so, I'm gonna piggyback. I mean, Tina and I have known each other for eons. Our kids went to school together. We grew up in the neighborhood together. So, my name is Sherry Healy. I am the executive director of a long-term drug and alcohol treatment center. I've been the executive director since 2009, been employed since 1995, but I've been underneath my mom's chair since 1968, so do the math on that one. My mom was the founder of Cedar Nar. She's a recovering heroin addict back in Seattle when nobody knew what heroin was. It was basically heroin and PCP, and she decided that there was really, they needed somewhere for people to go. There was nowhere for anybody to go. She had just gotten out of prison after 18 months for overdrawing her bank account for $500 because that's all they could get her on. And she knew that she needed the fellowship of others that were going through the same thing, and kind of created what was called back then a halfway house. And they worked together with some church officials and some other people in the community, some doctors, and ended up getting a house in Capitol Hill, and it kind of grew from there. And they used to do really strange fundraising, but back then, and then we ended up getting another facility in Georgetown and merging with Family House in Capitol Hill, and it was too much, and we combined everything, and now we're in Boulevard Park, and we've been in Boulevard Park since 2001. It used to be the Forest Glen Nursing Home, if any residents knows what that is. Born and raised here. I've lived in Normandy Park basically my whole life. And now I live in the house that I grew up in with my husband. So our facility is a little unique, and it's not the normal. It's not the Navos, it's not the Sound. We are founded basically as a long-term drug and alcohol treatment center. So most of our residents or most of our clients are there for 6 to 9 months, sometimes a year. In 2016, due to the crisis of not having detox, RCKC closed down, and we found a need, and I found space, and I just said, we're opening detox. I don't know what I'm doing, but we're gonna do it anyway. And then we opened 16 beds of medical acute detox. It was in a time when the state decided that they were going to go into a managed care, an integrated care model. Before, all of the residential providers were state providers. We had contracts with the state. They paid for 25 to 30% of actually our utilization, but all of the outpatient providers were kind of governed by their local entities, but us residential providers kind of had to fend for ourselves, and we got people from everywhere. But then they started to go to this integrated model, and it really kind of started to restrict, and it was a huge learning curve, as Tina knows. A lot of confusion for people that were looking for services. It was hard to navigate. It was very confusing. There was authorizations now, and before, when we didn't have that, we would just look at somebody and say, yes, you're in our level of care, come on in. And before, we were having to screen them and say, I'm sorry, but you don't qualify for a level of care, you've got to go somewhere else. Our residential portion is our long-term residential, and our recovery house portion is about 90 beds. So we're actually licensed for 107 beds within the Department of Health. I was just going to share what our mission statement is, because I kind of think it says kind of what we do. So we are a nonprofit organization that provides individuals with chronic substance use disorder 3 modalities of treatment: withdrawal management services, long-term residential, and aftercare, which is basically outpatient treatment, in a safe, supportive, and health environment that provides self-sufficiency, emotional growth, professional accountability, and personal value enhancement. Our goal is to really change lives one life at a time through modeling, education, and supporting individuals on their road to recovery. So our goal is a little bit different, because when our clients complete treatment, we expect them to have a job. We get them, employment preparedness. We expect them to have money in the bank before they leave. They have to have housing. So basically, most of our clients come in as Medicaid clients, and when they come out, they're just like you and I. And they're on their road to recovery. The other thing that we offer too, it's a behavior modification therapeutic community. So we're teaching and reinforcing daily living skills, and we have also the opportunity, we have a return to work program through our commercial recycling program at Cedar Knot Recycling. I'm sure there's people out there that go, I have those boxes next to my desk. That's us. So we teach them, you know, they have to apply for jobs, they have to go through interview processes, they have to deal with you know, what you do in a difficult situation when you have to deal with somebody who's your supervisor, or we try to enhance their self-esteem and put them in leadership positions that they probably didn't have. We're also fortunate enough to have a CDL program, and so if they can qualify, if they have a clean license, which is tough oftentimes, but if they have a clean license, we're able to put them through our CDL program. And what we really have done with Cedar Knot Recycling in the last couple of years is we've really made that a career choice and not just a stepping stone. A lot of times people with felonies, a lot of our folks are polysubstance users, have been through the criminal justice system more times than not, have had many failed attempts at many different modalities, and this is, I wouldn't say their last stop, but it's one that they can really rest and pause. And so now it's, you know, Cedar Knot Recycling isn't just a, you know, kind of a stop for employment, but we're really trying to make sure that, you know, they can have a career there and maybe be heavy equipment operating or a truck driver or whatever it is. So I know Tina was talking about the transition. There are a lot of barriers to get into treatment, not gonna lie. As of January 2020, they seem to have gotten a little bit more difficult. My job now is, I used to know all the clients in our facility. Now my job is legislative work, a lot of legislative work. As a matter of fact, we were up late trying to put a bill together. And really trying to get not just legislators, because they're really trying to work hard, but the funders, which are the managed care organizations, to understand our models of treatment in Washington State. And I will say Washington State is known for its a continuum of care. There is a multitude of ways to access treatment. And even in King County, there's a multitude of a lot of extra dollars that do specialized treatment that a lot of other states don't have. As a matter of fact, funny story is, we've had somebody that's been through our treatment facility a couple of times, and he's from Alaska, and he called from Alaska, and he says, I've been on Suboxone for 8 years and I need to get off and I can't, they won't let me. Can I come back to Washington in order to come back to your facility and figure out, you know, and get back on track again? And so we're trying to figure that out. But, yeah, I mean, I'm concerned also, I'm concerned with the way that I'm concerned with the homelessness, only because I live here. My best friends are family or a business owner, so I understand the frustration, and I live here, we eat here, we frequent everything. So I have a hat that I wear at home, I have a hat that I wear at work, and I try to figure out how to combine the two, and it's not really easy. So, you know, part of the things I want to say is that people have to get involved, and I think really the education piece, because it's not just what you see out there, it's what they've had to go through, or what hasn't worked for them and why they're there. But then there's also the point of, you know, they also need to be motivationally interviewed in order to do something different. And so there's got to be incentive in order for them to do or want to, you know, be compelled to do something different or know that they can be something greater. And it's not as easy. I always say that this is like a big wheel, and the wheel has a lot of spokes, and all the spokes are broken, and all the spokes mean different things, and they're all broken at different levels. And so I often, you know, as we start to talk about this, because we're passionate about it, and, you know, I'm on phone calls with colleagues all day long, and, you know, well, we need to get this, well, we can't get this until we get that, well, we can't get that until we get this, and we can't get this until we get that. So it's so multifaceted, and I understand everybody's frustration. But I do think that there needs to be more dollars put into it, because like she said, the workforce issue. Unfortunately, we believe in our line of work that our greatest counselors are those that are in recovery. But when they can go out and they can get a job and they can make twice as much, even though their passion is really consulting and counseling other people and being with other people in recovery, they have to make a living. And so before it was really easy. I mean, people would get through the end of treatment and say, I want to be a counselor. They'd say, well, let's put you into school. And now they're like, I'd really like to be a counselor, but I can go to Amazon and I can make twice as much money. I don't know, you use Amazon as an excuse, so. So the workforce is a big issue, and it's not about people and how many credentials they have, but it's about bringing new people into the system. It's about funding, it's about Medicaid rates, and you know, what it takes, and through this whole integration piece, the burden now, the administrative burden for our organization has doubled. And so what that does is that takes time away from the clients, which is unfortunate. And so we're trying to figure out how to make it work and how to balance. And it's kind of becoming about what is the lowest level of care that a person can get and still achieve the same results. But here's the other thing that I will say is they need to be their own advocate. So if they're really passionate or they really, you know, they're at that time where they really want help and really need to get help, they need to be the ones that say where they want to go, because that drives a lot of where they will get to. And I think that sometimes it's, that's kind of forgotten, or they have no voice. So I did bring some brochures. I did actually bring a story from a mother whose son has just recently completed treatment and has become employed at Cedar Knot Recycling, but she talks about her journey as to what it's like to live with somebody who has chronic addiction issues, that I think is kind of important to see not only what a person goes through that's in addiction, but also what the family goes through with addiction, and trying to take some of that stigma away, and kind of her journey of where she had to get to, because it's not just the person that's in addiction, it's everybody that surrounds them, and it's their whole journey. So, I mean, I could get into 10 more, but I'm not gonna get on that soapbox because I'll get in trouble. So,
Then maybe this question to you to start out. What are the legislative barriers to getting people into programs like this? I mean, you have people on the street who reject services over and over again. And I know, Tina, we've kind of talked, and some things that we've talked about in our groups before is that trying to understand, you know, I have children, and so they're not capable of providing for their basic needs until they legally become 18, because then we deem that they have their brains matured and they're able to get a job, they've got the education they need. But if you've got someone on the streets who, you know, starts drugs at say 15, and we know that medically that sometimes their maturity level kind of stalls, it stops at that age. And if they're not providing for their basic needs, you know, their shelter, food, and stuff like that, why do we give them that liberty to behave like a child when they're adults and not get them the help that they need?
Right.
Like, what's the legislative barrier to getting that help, sometimes involuntarily, until they're hopefully matured to that rate?
That's a great question, and you know, we're all parents, and for kids, they grow up, they move out, they move back in, you know, and we know that brains are developing till 25, right? And a couple,
later.
I don't know, I'm 21 and 24-year-old. So we're doing a couple of things, because I think that's really important. And one is, it used to be called PIT, Parent-Initiated Treatment. Now it's called FIT, Family-Initiated Treatment. But it's a new protocol that they're working on that would allow a parent to step in and initiate treatment when a young youth does not want to accept care. And again, it's mechanisms we haven't had. And a lot of parents have gotten so frustrated, they take their kid to Idaho, right? They take them across state lines because they can't get them into treatment because of that barrier. So we're hoping, and this is all we've been working on the last 2 years, so we're just starting to implement it and see how it'll work. The other thing is, I had mentioned changes to the Involuntary Treatment Act. So one of the things that the bill does that we really worked with Senator Dinker on is looking at grave disability. And for youth, it's always been this level of functioning, basically, you know, but we're changing it to words that are more around safety. You know, can they keep themselves safe? Because we think that word is going to allow us, for these youth that are being trafficked, right, that are being assaulted every day, to allow us to do more intervention. So those are the two things we're looking for young adults, but it's been an issue in our state. Well, the other thing that I work a lot on is called BECA, and it's the response when kids don't show up to school. And we know that they're less likely to graduate from high school. Kids get in a lot of trouble when they're not in school, a lot of stuff going on. And so we've been increasing intervention in elementary school when kids don't show up, as well in the middle school and high schools. And we started what's called a community truancy board, which they're always looking for volunteers to be on this board, community leaders. But it's where the family and students can go when they stop showing up to school to see what's going on, right? And it's supposed to be a source of support for the family. So I was talking to the Highline School District, and they had a couple examples. They said one family came in, both the kids had been missing school, and they found out the family was homeless, right? So they were able then to work with the family, get them housed, and now the students are back and they're doing really well. The other one they told me was a kid that was in the IB program, in the National Baccalaureate program, who stopped coming to school. Well, it turned out he was overwhelmed. And he was suicidal, and he was staying home, and they were able to work with him and adjust his schedule. So there's a reason kids don't come to school, and it often can be depression, mental health, being overwhelmed, or something going on within the family. So we are trying to get those supports to families and to students more rapidly, and we've been trying to change our system the last couple of years to do more of that. If Ricky's Law, talk about Ricky's Law.
I'm not well versed in Ricky's Law.
Okay.
And I know that Seattle or King County has had some issues implementing Ricky's Law. I think it's going to be better. But I think that there's a lot of hoops that you have to jump through with Ricky's Law. And I don't think and I kind of want to take the heat a little bit off the legislature, because I think it's a little bit bigger than that. And I think it's more with the Department of Health, and it's with DBHR, which is the Division of Behavioral and Health Resources, Rehabilitation. And I think that there's a lot of other government entities that kind of create policies, and then when we're not happy with them, then that's when we go to the legislature and we say, okay, you guys need to fix this because this is what's coming down the pike. So yeah, it's a tough. Melissa, I think your comment was about how do we stop them from doing what they're doing? How are we allowing them to not follow the law, basically, correct?
Well, I think just mentally you see that, people are stalled almost in a childlike state. They're not able to.
And it could be, and what we're seeing, I mean, I see a lot of second, third, and fourth generation addiction or trauma and the self-medication. I think that there's this whole thing about, and I think everybody needs to understand, the terminology now, it's behavioral health services. It's no longer mental health. However, some things are still mental health, and there's some things that are still, now we're substance use disorder instead of chemical dependency or drug addiction. Those are bad words now. And so we're trying to find this balance between substance use disorder and mental health, and now we're calling it behavioral health services. So we're trying to treat the whole person. So I know, like, for our agency, we have a lot, the young ones are the hardest ones because they want instant gratification. They want whatever they've got wrong with them, they want it done, and they want it fixed now, and they want the magic, whatever it is. And our process is we got to kind of strip it down, see where you're at, what's your life like, where is the trick. We want, and this is what irritates me, is because everybody just wants to throw a pill at it and make it go away, when we want to get down to the heart of who you are and figure out why you're self-medicating in the first place, or why you have tendencies to mental health, whether it be rage, anger. We've realized you have trauma, and we have a great rapport with all of our agencies around us. And speaking of trafficking, we went and Harborview has this fabulous trauma, and there's another couple others that have these fabulous trauma programs that get these women, and it's really odd, we're seeing a lot of men with a lot of sexual trauma that really rehabilitate, really get down to the core, and really help and heal while they're in a safe and secure environment. And my fear is that facilities like ours are not going to be welcome in the system anymore, because one, it's too long, they say, or they can get that in a lower level of care. But when you're homeless, or when you don't have an environment that's conducive to be supportive, it makes doing that behavioral work more difficult. And our facility is very structured, but there's also people that are in the same boat they can relate to. It's a peer-to-peer milieu. And so I digressed, as I often do. I squirreled, what we call it in my office. But sometimes there's just not an incentive for them to do anything different, or you have to meet them where they are. And sometimes even when you meet them where they are, where they have to start, sometimes it's just too difficult. We're trying to change. We're trying to change that.
Okay, go ahead and open it up if you guys.
Yeah, absolutely.
I want 2 questions for
Sherry.
One is, how are you funded, and 2, how do people find you?
So we're basically a Medicaid funded facility. I have contracts with all 5 of the managed care organizations, which is your basic Apple Health, Molina, United, Chippewa, Coordinated Care, and Merit Group. Most of the outpatient providers, at least in King County, know who we are. However, I just
So
realized.
it's by referral?
Yes, so
Okay.
in the old system, you had to go through an outpatient provider, you had to go to their orientation, get an assessment, go into their outpatient provider program, wait to get the authorization from the VHO if you qualified for that level of care, for our level of care, and then there's a warm handoff to find if we have, yes, see? Now we're finding that may change, and that because actually I lied. King County will still be the same. King County works in its own entity, and they are kind of a broker for the MCOs. I apologize, I didn't answer that one very well. Everybody else in Washington State, because most of our people may not come from King County, everybody else in Washington State can go through the managed care organization and usually find us. But King County is kind of still a referral base, but they can still call us, and my gal Carrie will say, this is where do you live, this is who you need to go see, this is what you need to do, and this is how you get to us. But they have to qualify for the level of care. So there has to be a chronic substance use disorder issue to be there. If they've been addicted for a year, I hate to really make this less than, but depending on what their treatment episodes are and if they've had failed attempts, and whether or not they have cognitive issues or if there's other factors involved, we have a full scale, but I don't want to bore you with that.
Well, some of the chaos, just so you know, is like years ago when I worked for King County, we integrated chemical dependency and mental health, right? And it was like, oh no, what's mental health going to do with chemical dependency system, right? Well, now it's like healthcare being integrated with behavioral health, and so now you have a lot of private managed care folks that are coming in
They're trying to swallow us up.
they're trying to who were part of the healthcare world, now taking over the behavioral health world. So that's a lot of the change that we're all sorting through. The hope is that it integrates care, but it also, I feel some tension with some of these private.
Everybody needs to stay in their own lane. I don't get in the primary care lane. I don't expect them to get in the chemical dependency lane or the mental health lane. I don't get into the mental health lane. We have a clear delineation of what we can do and what we can't do, but we can sure partner together and not have an issue with that.
Right. That's kind of what's going on in the system right now.
I have a question for Sherry, for you too. If I remember correctly, you mentioned the 6 to 9 months program, but you also mentioned a permanent residency. Could you please?
So I also have a 12-unit apartment building that's transitional housing. So clients that, if there's availability, I had to limit because people wanted to stay forever. It's kind of at a reduced rate, but everybody there is in recovery. And they can stay there for up to 18 months. So it just allows them to be with their peers, but it allows them to get back on their feet again. And if I could, I would have like 7 of them, just because for our folks, what happens is, the dynamic that happens is that, you know, they start to get clean and then they realize that they can't be, you know, they start to get afraid of being out in the open because they've been protected and it's working. And what happens if I go out and, you know, I stick my toe, you know, just in the water of just being in a neighborhood that used to be, that could be a trigger for me. But then if I know that I have to come back, then it's, you know, I'm safe and protected.
Yeah.
And so a couple of other things too I forgot to mention is that we also reunify families together, and we're also able to take parents with children up to age 12, which is kind of an anomaly in the state. And we have a lot of dads, which I'm trying to figure out how to get the reciprocity of the pregnant parenting woman to include dads, even though they may not be pregnant, but a lot of dads are getting custody of their children and we're fostering that relationship. So, yeah, so that's what we do. Yes, Mark?
Sharon, you said it's getting harder for people to get into the system. Is that what you said? It's more difficult to get in. Is that what you said?
It can be. It can be, and the reason it's the uncertainty of the vulnerable population, and I hate to say that, but they could be ready today, and then you say you go and do your orientation, and then they may not have the foundation to keep going. So if they know, and there's a lot driven. Drugs are rampant, and so it's easy, and so therefore why change what you already know, because it's easily, so when it gets harder is when they start to go, okay, I need to do something different. So a lot of times, you know, they'll go and then they'll do the orientation, and then it'll be a week before they can get their assessment. So what do they do for 7 days? Well, you can come to the outpatient groups, and sometimes for people it works great. And that's the robust thing about Washington State, is that there's a multitude of things that work for people. But for my specific population, oftentimes that doesn't work because then they get sick. And you know, they gotta feed the dragon. And they may go to a couple groups, but if they don't have somewhere to go supportive, if they are sleeping on a couch, or if they're in an abusive relationship or a toxic relationship, sometimes it just is difficult. Whereas, you know, and we're working on, as a matter of fact, we're working on a no wrong door bill right now. It's supposed to drop tomorrow, where we're talking about going to detox is an automatic, you don't have to have an authorization, it's an automatic 5 days. And we're trying to pass them where residential, you have 48 hours to do the authorization, get the treatment plan, the assessment, and in. So therefore, you don't have to go around here, you can just come straight to me. I mean, I can do a telephone screening, we can do an application, and know pretty much whether you're appropriate for treatment or not. Or we can say, you know what, this is where you would fit best. So there definitely, there's barriers, and I hear it every day. And there's not enough, and the other problem is that there's not enough beds, and there's not enough residential beds, and there's, back to the workforce, even the outpatient facilities don't have enough CDPs to take the workload. So,
How can we support that bill?
I'll let you know when it drops. I have a feeling there's going to be a lot of changes, and I have a feeling that the managed care it's a big financial burden for the managed care organizations, and so Lauren Davis, who if anybody wants to know, Lauren Davis is like our guru,
Yes.
representative for chemical dependency. She's the one that dropped Ricky's Law. She's a huge proponent of treatment, and she's definitely our RAM and is pushing forward. So we'll see how that goes. I mean, I don't know if anybody knows anything about politics. I got a crash course a few years ago.
Well, and it does make a difference to reach out to your representatives, let them know it's a priority. We used to have a centralized system, and we used to be able to fast track people, and we decentralized it. And sometimes you do things and you learn, well, maybe there's problems with how that works. And so,
good bills can go really wrong really quick, and it's a short session. And so, I mean, I'm happy to filter. I can filter that through Melissa. But it's probably, I don't know, for right now, it's like one of the main bills that's going to be dropped.
It's a good bill.
Yeah. I got introduced last session, and then it took a weird dive, so.
yes.
I was gonna say that you touched on several things here that a short question for you. Is it King County that has just said they're gonna spend like $100 million to set up a new organization for homeless? And if that's the case, I think that's something that not only needs to support, but what I see is massive amount of private organizations, everybody running their own little niche. It's a Band-Aid approach that needs a systematic approach like they're doing down in San Diego, for example. And why not roll all of these individual little organizations into a centralized organization like that, so you have coordination? Anytime you put a large group of people and organizations together, you'll get synergies, efficiencies, and more bang for your buck. That's the main question I have to you, what's wrong with that? And the second thing is, what do you say to Seattle when they just announced they're shutting down the last youth homeless facility down there, and that Burien is shutting down the annex, and that essentially these people, in some ways, are being pushed to South King County?
Yeah, no, those are good questions. The second question, they also closed the Sobering Center, which was named after Dutch, who I told you about, the Dutch Schisler Sobering Center. And so you're right, there's a lot of critical resources being shut down, and I think even part of the money that King County is going to provide, we need to make sure a certain amount comes to South King County, right? And that decisions move it to our community and that we have some control over how it's used. We used to have this group I went to, it was called the South King County Homeless Coalition, and I do hear that they might try to bring that back together, because that is bringing all the providers that are serving homeless to the table to have a more coordinated effort, which I completely agree with, and definitely will support that activity. And again, I think we need Dave Up the Grove and other people around these dollars to make sure there's a plan that's unique to our area.
The other thing too, yeah, it was devastating when the Sobering Center closed, because a lot of our detox referrals would come from there. And now the detox van, we're outside of the jurisdiction of the detox van, so the only place that they can take them is Valley Cities up on Beacon Hill. Oh shoot, and I just lost my...
It's changed with the involuntary detox, but you can't, isn't
If
it?
they expand it, that's great. I also, and my charge nurse with detox met with the lead program, which I think you guys have in February or March or whatever. And we met with them, and this kind of spurred after the last meeting when I heard Dan talking, and I've been trying, Dan and I have met several times, and I just said our detox center isn't full, and I just don't understand why. I mean, this is crazy, because if it's not full financially, I mean, I want to help people, but I also have to run a business. So I can't run a business if I don't have people that I need to help. So, you know, he suggested going to the LEAD program that's here, and I don't know if everybody's familiar with that, but they kind of meet the homeless where they are and try to cultivate relationships and you know, get them into services. And so I did meet with them and say, you know, hey, we're here, we're available, you guys want a tour? You know, I'm pretty much an open book and I'm a straight shooter. So nothing's come to fruition on that one, but you know, if they're picking people up or if something's happening in the middle of the night, at least, you know, our facility has the ability to be able to take them with a simple telephone screening that I actually gave to them, simple telephone screening to make sure that they're appropriate. But so that's how we're trying to help with this area here. But to also further answer your question about things closing, it's unfortunate, but either your rent gets raised or your daily dollars that you're getting, it just doesn't make ends work. You know, you try, and believe me, I don't know what their business model is, but it's really, you're fighting fires every day. I mean, I'm literally a cheerleader every day. It gets tiring every day when you can't do what you want to do or need to do.
I used to manage nursing homes, so I know exactly what you're talking about. But that's another story.
Yes.
A few years back, my doctor, my internal medicine guy, up and quit because he just got tired of all the regulations that are coming down from government.
HCA.
Whoever it was. He said when he started, he had one person on the front desk, he got 5. He said, that's nuts, I'm out of here. And so what is the legislature doing and those above to reduce regulation? Let people like yourself run your business and get out of the way.
Well, there are proposals for like single health payer system and what, maybe we need to create our own system versus working with a system that maybe isn't as effective. And so we do have leaders, Senator Karen Kaiser, who represents our area, is working on this as far as what to do around prescription medication costs, what to do around the managed care piece, and whether we could be streamlining healthcare in our state. Again, that's all a system changes, right? So, and I don't know, you feel that all the time, right? Every time the system changes, so, yeah.
When it changes, it must get more difficult rather than government getting out of the way.
I'll keep my inside voice in. So here's what I will say. I sit on an association, Alcohol and Addicted Persons. We represent substance use disorder professionals across the state, both private pay and Medicaid. And I know that the folks that represent the private pay are working with the Office of Insurance Commissioner. It really boils down to the health plans and the health plans that are there and their rule, and having the government bodies that oversight them to kind of regulate that. And I think that us as providers need to scream loudly, and that's kind of what we're doing. I know that I have a meeting with my colleagues that run other SUD facilities with the Healthcare Authority just to talk about kind of what's happening and what's changing in our industry with the managed care organizations. And it's interesting because the folks that we're dealing with in Washington State have been great, and we have great relationships with those folks, but they're national entities. And so they're governed by a national entity that may be in Georgia or New York or who knows where they don't understand the Washington system. But the private insurance piece has to do with the Office of Insurance Commissioner and the regulations that happen there. And it's kind of like the big box area. I'm a McClendon's, I like to say, and you're dealing with the Home Depot and the Walmart type of thing. So we just continue to fight to either make sure that there's funds that are available, and the last 2 years, last session and this session, we've really taken on the piece of being part of the solution, and so not just complaining about what's going on, but really looking at it as a systematic approach as to how can we work within this system, provide the care that we need, but in a way that's manageable and where these people are getting help. Because I always feel like when stuff happens, the providers are the ones that are, the ones that are looked at when it's our hands are tied, and it's really not. There's nothing we can do about it. It's somebody else. So
the one thing I'd say though is, having worked in the system for years, there was a lot of people who couldn't get any care. They didn't have insurance, and so now we have kind of opened it up, but we haven't created the capacity and the streamlined mechanism to get people the services they need. So it's this catch-22. I think we're kind of ahead of most states, but we haven't figured it all out. And we need the help of physicians and people that work in the field to tell us how to do it and do it well. The PATH outreach worker I was talking to today, because there's a lot of paperwork. Well, is all of that necessary? 40% of clinicians' time is doing paperwork, and that's time they're not seeing people that need their help. And so we do need to get relief there.
We're trying. We're screaming really, really loud. I mean, we've got 3 position papers that are out there right now talking about managed care accountability and making sure that the Healthcare Authority, just because you have a contract, making sure that, there's transparency and that, that you're really checking to make sure that they're doing what they're supposed to be doing. And, we're looking at that and making sure that, because when it gets hung up there, then we don't get paid. So we're also looking at how they're approaching just different levels of care and where the best, the evidence-based practices are, but we're still trying to make sure that the continuum of care is there and that they're not just funneling it. It's like having diabetes and saying, or having cancer and saying, sorry, but you can only have radiation, you can't have chemo. Well, you need both, along with a holistic approach to take care of yourself and people to wrap around you and support you. And so it's kind of the same thing as we're moving into kind of that medical field type of feeling.
I may not have this correct, but I thought I heard a news story fairly recently, and I don't know if it was the Supreme Court or a federal appellate court that ruled that basically homeless people have a right to the street. And I don't know if that was the street or public park, so I'm not sure of my facts, but you know what I'm
I
talking
did hear that too. I didn't read the whole story, but.
Okay, so do you know what I'm talking about? And,
Yeah, it's
Tina, have you
decriminalization, you can't criminalize being homeless. It was in Boise, yeah.
If they don't have a shelter, is the way I understand
Right,
it.
they had no alternatives to people being homeless. Yeah, I don't know the full details, but I think I saw that as well
I
recently.
thought it was parks.
It was parks, and it was in Boise, yeah.
I try to treat them.
Question.
I don't care they need, how is that? That's so much more humane and cost.
I may be the
Yes.
only one that doesn't know. Whatever the problem in Washington is that people can solve by running over the Idaho line, what is the barrier in Washington that I may not be aware of exactly what you're referring to?
Oh, that was to do with youth, that, because youth can consent to their own care in our state at a certain age, and so if the parents wanted to put their kid in treatment, but the young adult didn't want to go, then they couldn't force them to go, and so they would take them to facilities. I don't know exactly how they got them there, but in other states is what we would hear. But now we have what's called, it's a family-initiated treatment where there is a court mechanism. If you think, there's a lot of negative consequences and impact of drug and alcohol use, that you can mandate or go to the court to mandate treatment. So that's just starting over the last year or two, trying to get that system working.
Do you know the age on that? Is it just 18 and under? Older than that?
And 18, you're on your own person and you have competency, so I think it's under 18. I think it's like that age, like 14 to 17. Yeah.
I've been thinking about the law and designing law, that it sounds like law gets designed without any enough systems thinking or systems engineering on how that law is going to affect the design of a system, and that maybe there should be pushback on the law to meet the concern addressed by a requirement of the law in a better way that can be done more streamlined. Are there many systems thinkers in Olympia or on your team?
I would tell you, when I consider myself a long-term planner, is that often the legislature works in a crisis mode, right? That's not unusual at all. We had the McCleary case where we were sued to fund education. We've been sued about people going to jails. I've been working on fixing testing of sexual assault kits and survivors. We didn't get sued, but we're like, let's fix a broken system so it works. But it's difficult for the legislature because I think every session there's a new crisis, right? The crisis this year is what to do with transportation. And the crisis this year is we don't fund special ed enough. And we have a crisis in
There's still not enough
behavioral
money
health
in,
and
yes.
so it's a little crisis driven, so, when I work on suicide prevention or sexual assault, I try to kind of come up with a 3 to 5 year plan, right? And how does that all fit together? But there's so many people that touch these issues. I think we had 20 mental health, behavioral health bills last year. And I'm trying to navigate, a lot of them, work with different organizations, but maybe don't have a background, and how do they fit together? And that takes an enormous amount of energy, I'm sure, for you and other people to navigate those.
Well, and I will say that especially after last year, because we're fighting for chemical dependency treatment, and the mental health folks are, they've got their platform, and we're like, hey guys, we really need to work together. I mean, we're really not against each other. We're really, for each other in a bigger system, because most of our clients need both of our help. So I think that as substance use disorder professionals, we have really kind of banded together and really are really trying to take the approach of, let's, rather than 11 o'clock in a parking, or 8 o'clock in a parking lot, where there's been many times where I'm like, Dean, sorry, I gotta be on the phone for a minute, we gotta talk about this bill. And then you are on the defense of somebody that slipped something in that is going to totally annihilate what you're trying, what the goal is. So we're really trying to advocate more for the whole person, and we're really trying to say, you know what, in the off session, let's get together, let's sit at round tables, let's have work sessions and planning to where you don't have to go in next Monday and just go guns a-blazing, and then you're looking and you're trying to figure out, okay, well, who is gonna decimate, my bill, and, and you're, because you really do wanna have those conversations, because I think a lot of times, and especially as we're moving forward in this whole behavioral health, there's a lot of people that are entering into the game, managed care organizations, even the HCA, because, DSA, no, who went away? Or who got absorbed? Why can't I think of that? DBHR got absorbed into HCA. DBHR is the Healthcare Authority, and the Division of Behavioral Health and Rehabilitation got absorbed. Well, actually DBHR got split, and so it's now in Department of Licensing, Department of Health, and the Healthcare Authority. So go figure that one.
But I would say, and a lot of the bills I work on take 6 or 8 months of stakeholder groups. One of the things we did this year around children's mental health is we all met together and tried to come out with a plan of what to do. We're losing a lot of our kids to suicide. We don't have access to mental health. So we did come around a table and work for the next 6 months, and we'll be doing that. So we are trying to come together. I know that's a lot of us, that's our natural style, but we're trying to kind of hoard legislators and partners in a way that's more better planning.
You're in meeting hell, but it's important that you're on the conference calls and that you're passionate. Everybody that is in this field is passionate about what they do. And so we just want to make sure that the best foot is going forward, because a lot of times what happens is if you're not an Olympia and you don't have somebody that's overlooking stuff for you, stuff gets passed and then you're just like, wait, what? And then you have to abide by that law.
Sherry calls me.
I do, Tina. Go over and talk to. So or I come and just see you.
Yes.
So we have about 5 minutes left.
Okay.
From a practical point of view, the Housing First program that you mentioned makes a great amount of sense with all the services. So the question is the money, I know that. So we have so many homeless people and we need housing first. So how do we go about it?
Right, so I think it's sitting down with the county and partners from the state and the local jurisdictions and say, we need this resource. What does it look like in South King County? It's not just about the dollars, because you have to cite it. You have to say what models and who's gonna develop it, right? And there are people that do it really well. I mean, it's beautiful housing, there's incredible services. We gotta make sure the right people provide it, but it's a team, and there is this group now meeting for South King County trying to look at this. I think it's advocating with your local elected officials, your county, and with ours at the state, saying we want you to come to the table and create this housing. It does need to be cited somewhere, right? And that can be tricky too.
I have a follow-up question on that, because you said whatever, the proper housing. How do you feel about the mini house villages that are in Seattle right now and could be in Burien, mini houses?
Yeah.
How do you feel about that? The problem is that they're not being seen by the national government as permanent housing.
Right.
So after 2 years, people will be kicked out if they haven't found any other housing. So
yeah, that can be problematic. What I like about the other model is there's a lot of services on site as well, so that we want people to be successful, and sometimes people move out and they need extra support. I'm not necessarily opposed to tiny house, I just don't know if the model's working well, because some of it's already been shut down. So I think we need to understand how it would.
They didn't have the services.
They didn't have the services, because that's a critical, I'm a social worker, that's a critical piece, right? Is having the right support.
Yeah, I agree with you.
Absolutely, and I think that should be at the table to be looked at with whether that's a good model.
So that something is in the works here?
It's not, I don't know if it's in the works, I'm not sure, but I can check on that.
You said there are people meeting about this.
Yeah, there's a group
Where is that
that
group?
just came
Is it
together.
access by public?
Absolutely, I can see.
About Housing First?
They're meeting around developing housing in South King County.
Where,
and
in
I
Seattle,
know-
or they're meeting down here? Or they're meeting-
Well, they were starting a group down here. I was interested, I wanted to hear when the meetings were, because they want to kind of base it on a model. We have Nicole Macri as a representative who does a lot of housing development. And so I know they were trying to form that group, and I can let folks know when that's meeting, because I'd like to attend it as well. Yeah.
What's your views on, say, low barrier housing, or whatever they call it?
The
housing first?
No, low
Yeah,
barrier.
but the low barrier is what it is.
Well, housing first is, right, is similar in the sense that, you know, there's a lot of rules in some housing that you have to be clean and sober for 6 months and other things, and that's good. We need all types of housing. The housing first often takes people who maybe have not gone through and are in recovery, but it provides all the services on site so that they keep trying to do the motivational interviewing and help them make better choices. But they have a better shot if they're stable in housing coming into recovery than if they're homeless. Now, I would also send them to Sherry's place too. Right, but I'm just saying it's another model. We need a lot of tools. There's not gonna be one answer, and I do think it's an important model to have, as long as you have the right services. I don't think housing someone and not giving them services.
Regulated services is the key, because, and I know that there was legislature on, especially like Oxford houses, aren't certified or licensed by a state entity. And I know that there has been talks about if you're going to do that, then you have to go through a certification process. So somebody is kind of overlooking what you're doing to ensure that rules are being followed and that it's safe. And my population, I worry about the low barrier. Not to say that it doesn't work for everybody, because it takes a village, and I get it. But a lot of times that's a trigger for other people. So if you have people that are using and you're trying not to use, it becomes a trigger. So for some people it works, and that's great, and it reduces. It's a harm reduction model. So.
Yeah, I definitely agree. I've got a mechanic who's in love with the heroin addict. She lives in a low barrier place, and I think it has 70 rooms to it. And in 4 years, it's been 29 overdose deaths. So I'm really not so sure.
Wow, where is that located?
On Del Ridge,
Okay.
midway on Del Ridge Avenue. I can't remember the name of it.
That may be more of a halfway house?
No.
No, I have a feeling, there's a couple private entities that manage those sites. We've sent a couple people thinking that they were, understanding that they were going to clean and sober housing, and the house managers weren't reporting to the other people, so they didn't really know what was going on. And our folks got in there and said, I can't be here, and well, why can't you? Well, this is going on. Well, I didn't even know that was going on. So it's a multitude of issues. It's a multitude of issues on both sides. But that's it. I'd like to know, though, maybe more where that is.
They work for Pioneer Industries. So
Pioneer, yeah.
You know,
Great
like,
work. Yeah. It's a great question.
I email a lot of stuff.
You were mentioning that there's lots of drugs. We need that on there.
I think you
What's the
mentioned-
question? What's the question?
He said that I mentioned that drugs are rampant, meaning that they're easily accessible, and what's being done on that front. I'm not a law official. I don't know. I just know that, well, if it's readily available, a lot of people won't seek treatment because there's no reason to do anything different. So we would have to get law enforcement in here to talk about that.
Which we will.
Oh, good. Well, thank you
Thank you.
for inviting me.